This is a revision video for P4F and G, gamma X-rays and their uses, and gamma radiation and medicine. X-rays are similar to the gamma rays produced in radioactive decay. They are both types of electromagnetic wave. X-rays and gamma rays have very high frequencies and have very small wavelengths. Gamma rays come from the radioactive decay, and X-rays are produced by fast-moving electrons. X-rays have got a number of uses. They're used for taking images of broken bones in hospitals, in airports to look inside people's luggage for security reasons, and to look into the structure of atoms in solids. This technique is called X-ray crystallography. During an X-ray, the patient is placed between an X-ray machine and a photographic film. The X-rays can pass through the patient, but the more dense parts of the body, like the bone, absorb some of them. The amount of X-rays reaching the photographic film varies, and an image of the bone is created. The people that take X-rays in hospitals are called radiographers. Radiographers either leave the room or stand behind a LED screen. Otherwise, they will be exposed every day, and this would add up to a higher dose than each of the patients receive. X-rays are produced by firing high-speed electrons into a metal target which is inside the X-ray machine. Very high voltages are needed to accelerate the electrons to a high enough speed to produce X-rays. When the electrons smash into the plate, the X-rays are emitted. The advantages of X-ray machines is that they can be switched off, whereas it's not possible to stop nuclei emitting gamma rays. Changing the voltage used in the X-ray machine alters the wavelength of the X-rays. This is very useful because shorter wavelength X-rays can penetrate further into a material, so they can be used to look at denser parts of the bone. Gamma rays are the most penetrating of the three types of ionizing radiation, and they are the least ionizing compared to alpha and beta. Their high energy and ability to ionize atoms means that they can damage or even kill living cells. Exposure to too many gamma rays can lead to cancer or even death. When used properly, gamma rays have got very useful medical applications. One of these applications is their use to sterilize medical equipment. Pieces of equipment are sealed inside plastic and then enter a machine where they are irradiated by gamma rays. The gamma rays kill all the bacteria and the living things on them, making them sterile for use with patients. Another medical application of gamma rays is the gamma knife. Normally, ionizing radiation is considered to be harmful to healthy cells and can cause cancer. However, this ionizing property can also be used in a positive way to kill cancerous cells. The gamma knife is used in hospitals to focus gamma rays onto cancerous cells. The key thing about the gamma knife is that it can be accurately rotated around the patient in order to give a full dose to a specific point within the body, while giving a low dose to the healthy parts of the body. So we focus in the gamma rays on just the tumour. That means that there's less damage or less exposure to the healthy tissue. Gamma rays can also be used as medical tracers. It can help to diagnose problems without the need for an operation. A special sample is produced which contains radioactive atoms. This is either eaten or injected into the patient. An image of the patient's internal organs can be produced. The radioactive source is selected must emit gamma rays. The source must also have a very short half-life. When a radioactive tracer is injected or ingested, the doctor must allow a short time for the tracer to travel around the body. When the source is spread throughout the body, special cameras are used to monitor the radiation which leaves the body. If there is a blockage or a tear inside an organ, the radiation emitted from this area will be different. Specially trained doctors can look for these differences and use it to diagnose a problem. The gamma sources used in medical tracers must have a short half-life. If the half-life was too long, the source would continue to emit gamma radiation long after the medical procedure was completed. A short half-life allows the camera to detect the fluid during the procedure but the activity of these sources to drop quickly to cause as little damage to the patient's healthy cells as possible. Medical tracers can't use alpha or beta sources. It would be far too dangerous to use alpha or beta sources because once drunk, they would ionize healthy tissue inside the body and cause damage. They also wouldn't be able to exit the body in order to be detected because they would be absorbed by the tissue inside the body, so they would never reach the sensor. Okay, that brings an end to this revision video for P4, F and G, X-rays, gamma rays and their uses, and gamma radiation and medicine.